On this edition of Primetime Politics, a stark warning from federal officials. If the Omicron variant becomes established in Canada, we could see 10,000 cases a day by January. We'll speak with this infectious disease specialist about the latest on the variant and Canada's efforts to stem the tide. Our MPs discuss inflation and next week's economic update. And our journalist panel will be in to look at whether the government has done enough to improve its COVID border measures. But we start with the latest modelling from the Public Health Agency of Canada. Infections are currently already rising in parts of Canada, but the agency is forecasting a much more dramatic surge in infections if Omicron becomes established in Canada.
I'm just urging extreme vigilance and caution because the Omicron variant could take over pretty fast, and we don't know what the impact is on the severity indicators or on hospital capacities, and that might be different in different jurisdictions. To look at the latest developments in the pandemic, I'm joined now by Lisa Barrett. Dr. Lisa Barrett's joining us from Halifax. Dr. Barrett is a clinician and an infectious disease specialist with the Department of Medicine at Dalhousie University. Dr. Barrett, thanks for taking the time.
Good afternoon.
You have watched today's briefing, the latest modeling and the scenarios that were presented. How do you react to the scenario if the Omicron variant becomes established in Canada? It's a fairly dramatic scenario.
It is a dramatic scenario, and both the number of cases and potentially the impact on our health system is quite marked. I think it really does highlight a couple of things. I think they did highlight the fact that there is some uncertainty about exactly how infective or transmittable the Omicron is, but we do have to consider the worst case scenario, that it is more transmittable. And then we look to what that means for our health system. Right now, specifically related to Omicron, it does look like the symptoms can be somewhat milder, which may go okay. However, the problem is if we get a large number of cases, even if the percentage of people that end up in hospital is lower, we may have difficulties, especially when we have some uncertainty about the match with vaccine at the moment prior to boosters.
Well, that's interesting because the last time we spoke was 2 weeks ago, and it was the very day that they announced, that we became aware of the Omicron variant. What more do we know now as we speak? You mentioned it appears to be producing less serious symptoms. That appears to be. What about transmissibility? And you mentioned vaccines.
Well, the three things we always look at: transmissibility, severity of disease, and what is the match with a vaccine in terms of protection from the very bad things. Right now, we know that it appears in South Africa that the symptoms in folks who were infected is somewhat less, but we don't necessarily know that that is something that we can extrapolate to all other countries and all other settings, mainly because we have different amounts of Delta and we have different amounts of vaccination. So although we're not certain, we're going to take the prudence principle there and say maybe slightly milder, but let's not hang our hat on it. And then with transmittability, there is some data coming out that suggests that it may be more transmittable. Again, it's a maybe, but again, can't ignore that fact because that's the danger part here. And then vaccination, we're still in the process of learning more. Some companies have come forward with a suggestion that an additional dose of vaccine may be helpful in increasing protection. But again, those data I have not seen. It's by press release, and certainly I think it would be hard to say anything about that in the real world yet.
The WHO warned against quick conclusions about vaccine efficacy, saying that those studies had only looked at I believe it was the antibody response, and it was only a partial study of the immune system. So it was too early to conclude anything.
Absolutely, very much so. And everything I'm saying today is slightly further ahead than it was a couple of weeks ago when this first came to our attention, but we really don't have enough information to start making broad, sweeping policy decisions like boosters for everyone in case Omicron comes by. That would be premature, and right now I think people should definitely feel good about protection from their vaccines as they stand for Delta. Always keeping in mind as we go into the holidays that we need to think about layers of protection, not just one tool, but using all the tools at our disposal, including good public health measures, vaccination, and testing where it's available.
Okay, I want to ask you about controlling the spread. 10 days after Canada announced that we would be doing airport testing of international travelers from everywhere but the United States, that we would be tested at the airport, Health Minister Jean-Yves Duclos today said that we're only up to half capacity of that testing, and he can't say when we'll be up to full capacity. Should we be concerned if we're concerned about the spread of the variant to Canada?
One of our best defenses in a viral pandemic is to know where the virus is and what it is. That becomes more difficult if we don't have our testing in place. That does concern me. It doesn't panic me because we should still all be doing the things we need to do and assume that there is virus around us. So does it panic me? No. Do I think it's good? Not really. And are there other strategies we should be taking while that testing is being ramped up further to help mitigate the risk? And by that, I mean other forms of testing. For example, rapid testing being available to people on a voluntary basis would be a great stop measure while they're fully ramping up.
Okay, another question then. Should we be assuming that there's a degree of community spread? Because we have seen some cases of the Omicron identified that aren't even associated with any travel. So should we assume that in some places in Canada it's here and already community spreading?
You know, I really don't spend a lot of time dividing my head between COVID Omicron and COVID non-Omicron at the moment, although I really want to know more about this and where it is. I presume areas that have cases and places that do have documented community spread have it. And therefore, the approach at a public health and personal level should be the same. We should be doing our risk assessment and making sure that we're taking precautions recommended in our local areas by public health. And if we do that, then we do have some ability to control, because we know Omicron is likely to be controlled by those basic core public health measures. So, you know, I'm hoping that folks assume when there are cases in their area, they need to stick with the public health measures, even though it's tiresome over the holidays. We need to do that, Omicron or not.
Okay, in the same vein then, if we just look at COVID, and we won't make the distinction between the new variants and the old and the medium old, they used to be called breakthrough infections, but we're hearing about rising rates of infection among those who are fully vaccinated. This past week in Ontario, the figure was almost around 40% of people who had been vaccinated and were infected. So what should we make of the trend?
Yeah, I think completely expected. When you've vaccinated almost everyone, of course, the percentage of cases that show up in the almost everyone are going to be higher. And so I don't think that that is unexpected. And most of those cases are milder, even in people who were at risk, than we would have expected in unvaccinated people, which does tell us vaccines are still doing what they're meant to do. I do think, though, we have to be mindful of how many cases we're permissive of in our communities, because even if it's a far less risk of being hospitalized, if you're vaccinated, if that percentage, that absolute number gets too high because our cases are so high, then we're again going to still have a problem in our hospitals and we won't be able to keep up. So we do need to keep an eye on the total case number still, while recognizing that vaccines are still our best tool here. Breakthrough cases, not as severe, but we still have to keep the number at a reasonable level or we will start to fill our hospitals.
All right, Dr. Barrett, thank you very much. A pleasure as always.
Thank you.
Well, joining me now to take a look at the last days of the fall sitting of Parliament are three MPs from the different parties. Rachel Bendayan is the Liberal MP for the Montreal riding of Outremont and the Parliamentary Secretary to the Minister of State for Finance. Randy Hoback is a Conservative MP for the Saskatchewan riding of Prince Albert and the Conservative International Trade Critic. And Peter Julian is the NDP House Leader, Deputy Finance Critic, and he's the MP for Westminster Burnaby. All three of you, thanks for joining us.
Good to be here.
Okay, Rachel Bendayan, let's start with obviously Tuesday's economic statement from Finance Minister Chrystia Freeland. We're getting more and more indications, as journalists often do, that this is not going to be a mini budget. It's not going to be a big affair, as some economic updates have evolved into. There won't be a lot of huge measures announced. So what should Canadians expect?
Well, the Deputy Prime Minister and Minister of Finance was very intent on making sure that Canadians understood the fiscal position that Canada finds itself in now. I think it's an economy that looks quite different from just a year ago when we were at the height of the pandemic. But let me begin by saying that there is absolutely no more important economic policy to our government than finishing the fight against COVID. And so you will see that reflected in the fall economic statement. But as you said, Peter, I think Canadians should not necessarily expect a budget that will come in due course. But what is important is to be transparent about where we're at. We had an excellent Q3, very robust economic numbers coming out of the last quarter. And we have actually beat our target of having created 1 million new jobs. We are well over that now. We have recovered 106% of the jobs lost during the pandemic.
Are there going to be any specific measures announced?
Well, we have a specific measure on the table, and that's found in C2. I was disappointed to see that the NDP and the Conservatives vote against this bill, which provides important economic measers for workers and for small businesses.
Okay, I'm just thinking of the economic statement, though, or the economic update. Any more specific? Okay, we'll get back to that. Randy Hoback, what does your party, what do the Conservatives want to see specifically in Tuesday's economic update?
Well, it'd be nice just to see where they spent the $600 billion and how they allocated it through different resources and how it reached Canadians. We're hearing accusations and reports that organized crime received some of those funds. We're hearing all sorts of stories that people that didn't need it received it. So, we'd like to see some transparency, some openness on exactly how they spent that money and what their plans are going forward to make sure that doesn't get repeated. So we have some concerns. The Liberals have a great infomercial. They talk the talk and they make it sound like everything's under control. But when we look at the details, we see that it's not. And Canadians are really hurting right now, and we're feeling it in their pocketbook. We're just in Costco this last week. A price of a steak went from $35 for 2 rib steaks to $65. So those are the interests that are things that are interested to Canadians.
Are you looking for any specific measures beyond just an update on the economy?
Well, we want to see where we're at. We need to have an understanding of exactly how they spent this money and where it went and was it efficiently and effectively spent. It's taxpayers' money. It belongs to the taxpayers. It's not Liberal money. So we want to make sure that's exactly what it did. It went to the people that required it and needed it during the COVID crisis. But then we also want to see a game plan moving us back to some normalcy, going back towards a balanced budget, going back to some fiscal responsibility in a prudent manner. So, those are the types of things that we'll be looking forward in this on Tuesday when it comes forward.
Okay, Peter Julian, in a nutshell, what would you hope to see in the update?
Well, the Parliamentary Budgetary Officer yesterday released a report that showed that over the Liberal mandate, we've seen a unprecedented increase in concentration of wealth among the very ultra-rich. And for many, many Canadian families that are struggling to put food on the table with rising food prices, to keep a roof over their head with rising housing prices, to pay their bills. When you see at every step, Canadians are being gouged, paying some of the highest cell phone fees in the world, for example. And so the government needs to be attentive to that. And the fact that they have refused to take any measures against the ultra-rich, no wealth tax, no crackdown on overseas tax havens. As we go through this pandemic, despite the rosy words of the Liberals, the reality is food bank lineups are longer than they've ever been. Homelessness is climbing. Many Canadian families are struggling to make ends meet, and yet the Liberals refuse to take the measures that would actually provide the wherewithal to make the investments that would actually help families. That's what we expect to see. That's what Jagmeet Singh is talking about, investing to support families.
Okay, Rachel Bendayan, you mentioned, you make the point that this is not a budget, but we do know Chrystia Freeland, Finance Minister and Deputy Prime Minister, on Monday, so before her Tuesday economic update, will be announcing with the head of the Bank of Canada the 5-year review of the Bank of Canada's mandate. That's kind of crucial to a lot of the discussion we've seen in Parliament for the last week and a half as to the question of whether your government will change the Bank of Canada's mandate. It calls for a limit to inflation, for the bank to limit inflation to a range of between 1% and 3%. Should we expect a change in that target or in the bank's mandate from your government?
I'm sure you and everybody watching is very intent on also tuning into the press conference that Minister Freeland will be having with the Governor of the Bank of Canada on Monday. I believe it's going to be at 11 a.m. And I, of course, believe that the Bank of Canada is an extremely important economic institution for our country, but it's also an independent institution. And so I think that the Governor will speak in the name of the Bank of Canada on Monday, and the Finance Minister will speak for our government on Monday in order to update Canadians on that.
But this, as you know, there have been all sorts of accusations of whether your government has interfered or not in the Bank of Canada. This is one of the legitimate inputs that the government has into the Bank of Canada. It's a 5-year review of the mandate and whether the mandate should be changed. Do you think there's room for a change in the mandate of the Bank of Canada?
I'm not going to address accusations which are completely unfounded.
Right, but mandate change.
What we've been seeing in the House is the Conservatives accusing the government of printing money. Nothing could be further from the truth. And I will never apologize for the government supporting Canadians in their time of need during a global pandemic.
Mandate change, though.
In terms of the Bank of Canada's mandate, that is the subject of the press conference that the Finance Minister and that the Governor of the Bank of Canada will be having on Monday. I encourage you all to stay tuned.
All right. Randy Hoback, should the government announce, as it legitimately can on Monday, a change in the Bank of Canada's inflation fighting target?
You know, we've been asking for around 2%. Is that the mandate or not the mandate? They won't give us a straight answer in the House Commons on what their targets are. I think from a Conservative perspective, we look at it from the position of a family, the family that's struggling right now, that's looking at, you know, how can I buy Christmas gifts for my kids? How can I afford to put gas in my car? How can I pay my heating bill? How can I pay my mortgage? You know, that's the real concerns of Canadians. So if you are actually going to look at it through that lens and say, okay, to the Bank of Canada, how do we keep things in a situation so that we can have average Canadians being able to afford to go out and buy food, to go out and buy gas, to do the things that they have to do? That should be around the mandate. So, you know, the concern I have here is the Liberals have no clue. They don't understand or seem to understand that things have gotten more expensive. And some of the actions they've taken over this last year has fueled that inflationary crisis. So, you know, until they take responsibility for actually being part of the problem, they can't fix the problem. And, you know, they're in deny. Well, reality is, food is getting more expensive. Gas is getting more expensive. They put policies in place that actually are making things more expensive for the average Canadians. Okay. And, you know, they need to backtrack on some of those decisions.
Peter Julian, the current mandate is for the bank to set a range between 1% and 3%, which usually ends up being around 2%. That is the current mandate of the Bank of Canada to fight inflation. Should the government change that? Is there any role for the government changing the mandate of the Bank of Canada?
No, we've actually, NDP members have actually asked this question of the former governor of the Bank of Canada and the governor of the Bank of Canada. And there are a couple of other imperatives. We're seeing increasing poverty and inequality. And the idea of a jobs mandate, of an employment mandate as part of what the Bank of Canada needs to consider is something that for a long time people have advocated for. We also, and the Bank of Canada is the first to admit that increasingly they are taking it into consideration amongst their policies, is the whole issue around the climate emergency that we've seen with devastating impact this year, killing hundreds of Canadians, causing billions of dollars of damage, cutting off one region of the country from others. These are all things that we need to have a much more holistic approach, I think, in terms of the crises and the challenges we're facing. And this is where I think the government falls far short. I mean, we've seen an increase in inequality, concentration of the ultra-rich at a time when so many Canadians are struggling even to put food on the table. And I would ask Liberal ministers to go out to the food banks that they're seeing with the longest lines we've ever had in our history. These are signs that things are not well for a significant proportion of Canadians, and we need to have government policies put into place that will actually lift Canadians rather than pushing them down.
Okay, on that note, I want to thank all three of you. All of us will be watching with great interest both the announcement on Monday as well as the economic statement on Tuesday. Rachel Bendayan, Randy Hoback, and Peter Julian, thanks for speaking with us.
Thank you.
Thank you.
Thank you.
It's time now to look at the week's political developments with two members of the Parliamentary Press Gallery. Marieke Walsh is a parliamentary reporter for the Globe and Mail, and Janet Silver is a managing editor at iPolitics. Both of you, thanks for joining us.
Hey, guys.
Okay, let's start with one thing that caught my attention. We had the briefing today from Health Minister Jean-Yves Duclos and the officials from the Canada Public Health Agency. But he revealed that 10 days after announcing that because of Omicron, Canada was intending to test everyone at the airport coming from international destinations outside of the U.S. That was supposed to be put in place. But today, we're still only halfway to testing all of that target group. And he couldn't say when we'll be testing them all. I'll start with you, Marieke. What do you make of that?
I mean, it's to be honest, the same thing they've been saying now for about a week and a half, insisting that these rules are in place while also admitting they're not fully in place. And when you look at the government's own travel website, it says that the rule is, quote, coming soon. And so this really does tie into these questions around whether the federal government and all of its agencies have the capacity to act on the rules that they bring in place. This is what the Auditor General also raised this week, and she said that they have failed to enforce the past border measures. Minister Duclos says that they are getting much better now, and it seems that they are increasing. But again, if they're not telling us when it's going to be fully in place, then a measure that's supposed to stop a variant that's already here is not actually in place. And so what is, every little bit helps, but certainly it raises questions about the efficacy of what they're doing.
Mm-hmm. Janet, your reaction. I know you watched the Auditor General's report too, and there is a resonance there, given what she had discovered for the government's performance between February and June of this year.
Exactly. And Duclos has said, the health minister has said, look, we're trying to do better, and acknowledge that they weren't doing well enough before, saying, we've hired additional services to help us do testing. But like Marieke was saying, this far in already, and we're still at half capacity in terms of testing, it doesn't seem at first glance that we've really learned the lessons from before. One would expect, knowing that there are variants and there'll probably be more variants, that we should be ready at airports. It's one of those things that a lot of people who are contemplating traveling, I think, are now going, maybe not, because there's so much confusion as to what is going on in terms of testing, and that's confusion across the country from coast to coast to coast. You don't know, there's more tests being done at some airports, and you just don't understand or don't know, and you can't get that from the government. And for them not to be able to say when we're going to be at full capacity or when we expect we'll be at full capacity still raises a lot of questions.
Is one of the difficult things, and Marieke, you referred to it, and that is we have these policies, but for example, when the question is often asked, why are we not testing people coming from the U.S., many people have said off the record, well, we just don't have the resources. That would overwhelm our testing capacity. So is the whole question Canada not having the capacity to fight a pandemic?
Yes, I think that's correct. And I also think it's correct that it goes beyond this issue of the borders. At the press conference following the AG's press conference yesterday, the Auditor General's, Minister Duclos issued a mea culpa. He said at the beginning of this pandemic, the Public Health Agency was essentially a research agency operating at a macro level. Their role at the time was to anticipate pandemics, which the Auditor General has already said that they also did inadequately or failed to do. But their role was not to gather data on hundreds of thousands of travelers, track them, be able to share that information. And so they have been building all these things in real time. But certainly when we're unable to say when a rule that was apparently necessary and announced 2 weeks ago is going to be in place, it raises questions not just for travelers going through the system, but also for the management of the spread of COVID-19. And it raises questions about how this will be managed going forward. I think it's pretty obvious to say that if we do not have the testing capacity for all air travelers outside of the United States coming into Canada, then we certainly don't have the testing capacity for all air travelers, including those from the U.S., because the U.S. is our biggest source of these travelers. Yeah. And so clearly, whether they're saying it or not, they don't have the capacity.
Yeah, I mean, there's many, many lessons to be learned from this pandemic, and they will be learned over the years. But let's look at another big event that's coming up next week. As this fall sitting of Parliament starts to wind down, the big event that a lot of people are waiting for is on Tuesday, and that's the economic update. We have every indication that this economic update is not going to be like some of them have become, a big mini budget with lots of measures mentioned or announced. There is a suggestion there'll be a few things announced. Marieke, what are you watching for?
I think that whether or not there's big measures has more to do with the fact that we just had a budget and then an election. So there hasn't been a lot of time in government to actually do the policy implementation and execution of what's already been announced, let alone enough time to develop new policy, given that we've been in caretaker mode for much of the last half year. I think this is going to be a budget or an update that really is, again, unfortunately, back to a question of the pandemic, what this economic update says about where the government expects the pandemic to go and the impact that that will have on our healthcare systems, on our economy, on businesses and individuals. Because I think that's still, the government wants to get past it, everybody wants to get past it, but that's the immediacy of what they need to be dealing with.
Janet, what are you watching for? Obviously, we've just spent the last 10 days of Parliament watching the opposition parties drumming the government over, accusing it of being responsible for inflation. Some of them are pressing for some measures. What kind of dynamic, what are you watching for, and what kind of dynamic are you watching here?
Well, first on what I'm watching for, there are three things. The government has talked a lot about housing affordability, so I'll be interested to see whether or not there's anything more that comes out of this fall economic statement in terms of housing. That's something that's also come up with the opposition. Another thing I'll be watching for is what they're going to talk about in terms of the seniors, the guaranteed income supplement. It's something that the Bloc and the NDP have been talking about for months, especially given all the pandemic benefits and the clawbacks that have happened for seniors on guaranteed the GIS. It's been really difficult for a lot of seniors on a fixed income. Freeland indicated the other day that, yes, there was something coming from for seniors. They understood that there was some real problems there. I'll be interested to see if they address that in the fall economic statement. And the third thing is with regards to inflation. I know the Conservatives have talked a lot about this. It was mentioned only once on the throne speech. We're at an all-time high, for 20 years at a real high. We just had the PBO, Parliamentary Budget Officer, report yesterday talking about the gap between the rich and the poor and how that is increasing. So there's a lot of pressure on the government to do something to address the rising costs and inflation. It'll be interesting to see how they address that in this fall economic statement. And if it's not mentioned, of course, that will give the Conservatives a lot of fodder because it's something that they've been raising almost every day in the House of Commons and calling it just inflation, which ironically is something that the Prime Minister even spoke on yesterday in the House of Commons in the question period as well.
Got quite a reaction out of that. Last question, quickly, Marieke. With my MPs, we discussed the Monday announcement of the new mandate or the mandate review of the Bank of Canada. That's sort of crucial to the whole debate, too, about inflation. And the rumors are that it's going to be basically very similar to the current inflation-fighting targets. That's something to watch as well.
Certainly, and if the government hopes can deal with some of these cost of living questions and inflation questions ahead of the fall economic statement. But I think Jen is correct that the cost of living is going to feature largely, and that's because it is what's on everybody's mind. When you talk to MPs, that's what they say their constituents are seeing. So, yes, every party is talking differently about inflation, who's to blame, what the solution is, but every party is talking about it because it is so significant to the actual everyday lives of the people they're serving.
Okay, well, and also, obviously, Janet, as you mentioned, with Chrystia Freeland saying that there will be some sort of announcement about how they're going to deal with this clawback of the GIS on pensions, that's key to getting an accord with one of the opposition parties for C2, the bill for their new pandemic support. I want to thank both of you. Thanks very much. Have a great weekend, and we will regroup. Obviously, we'll watch both Monday and Tuesday's announcements with great interest. Thanks to both of you.
Thank you. Happy Friday.
Well, that's it for this edition of Primetime Politics. I'm Martin Stringer. Thanks for watching, and have a great weekend.